Ms. Jessica Tan.
Mr. Speaker, sir, may I request that I answer questions for oral answer 1 to 9 and questions for written answers 32 to 36 together. Thereafter, Senior Minister of State, Dr. Janio Puthucheary, will answer questions for oral answer 10 to 20 and questions for written answers 27 to 30, and both of us will then take supplementary questions together after our respective answers, please.
Please proceed.
Thank you. Mr. Speaker, sir, the recent move to quickly tighten safe management measures was a difficult but necessary decision. We are committed to our plans to open up and transit to a COVID-resilient nation. Hence, lockdowns like circuit breakers are no longer an option, because many workers, families, students, businesses are going to suffer for it, and it will affect our ability to earn ourselves a living in the long term. With the great majority of our population, over 83% fully vaccinated, we are one of the most highly vaccinated countries in the world. As a result, during this wave of infection transmission, over 98% of infected individuals experienced mild or no symptoms. 1.7% require oxygen supplementation in hospitals, typically for a few days. 0.2% require ICU care, and unfortunately, 0.1% passed away. Although only a small percentage of infected individuals require hospital or ICU care, we also admit many more others for observation because they are at risk of developing serious illnesses. So when infection numbers rise, all these translate to a large number of hospital patients, which put considerable strain on our hospitals and our healthcare workers. Hence, even as we continue our journey to transit to a COVID-19 resilient nation, we should also have a care for our hospitals and our healthcare workers, and tap on the brakes to slow down the rate of transmission. This is why we had to implement the measures under the stabilization phase last week. And unfortunately, in this rapidly changing and evolving situation, we have to stay agile, adapt, and respond quickly. We will try to give as early a notice as possible to businesses, but there is a practical limit to that, and we seek your understanding. On the home recovery program, this is an important part of our response, given that the vast majority of infected individuals have mild or no symptoms. They do not need special medical care and can therefore recover safely at home. Mr. Dennis Tan asked if individuals can request to be sent to an isolation facility instead. We have been considering and accommodating such requests, taking into account the medical conditions of the individuals and their family circumstances. But it is also important to emphasize that individuals and families should, and in fact have been, making adjustments to their living arrangements to make HRP safe and possible at home. Because it is only with a high take-up of HRP that our hospitals can focus resources on those who may require greater medical attention, including non-COVID-19 patients who need acute hospital care. This will enable our healthcare professionals to concentrate on those who need those acute hospital care. In response to Mr. Xie Yaoquan, in the initial days of HRP, a fair number of patients without serious symptoms did make their way to the emergency departments of hospitals. We did not compile the numbers, but it had led to overcrowding of the departments. We understand the anxiety of these patients. It is therefore important for us to iron out all the teething issues of HRP so that there's a strong sense of assurance as patients undergo HRP. Over the past few days, such incidences have been significantly reduced. Over the past week, and with the SAF overseeing and operating the program end-to-end, we have been ironing out the teething issues, resolving service lapses, including those relating to timeliness of notification and conveyancing, and also improving communications with patients and their families. Things are improving day by day. In response to Ms. Cheng Li Hui, currently there are about 9,800 people on the HRP, and they are recovering well. Over 2,800 has been discharged as of 3rd October 2021. Every day, over half of infected individuals will be onboarded on HRP, and we expect the proportion to continue to rise. In recent days, for those eligible for HRP, 93% are contacted promptly and smoothly onboarded. But we still have difficulties contacting a remaining minority because there was either no response or contact details are not accurate. So this is another teething issue that we are ironing out using IT solutions. As for those who are illiterate and do not understand the SMS notifications from MOH, we hope family members, neighbors, and volunteers can give them a hand. That is why our partnership with the People's Association is very important. Over the weekend, volunteers have been mobilized to reach out to residents who have been served HRP notifications. And I thank the People's Associations and all our volunteers for their hard work on the ground. As the patients are generally well, we have also kept the involvement of telemedicine providers quite light and have patients call them only when they need medical attention. In response to Mr. Xie Yaoquan, typically, after a person is detected as COVID-19 positive, MOH will contact him within 24 hours, where triaging will be done and the decision will be made on whether he will be on HRP or needs to be conveyed to a care facility. In response to Ms. Ng Ling Ling, amongst those on HRP as of 26 September, about 400 are persons under quarantine who subsequently tested positive for COVID-19. 95% of them are eligible for HRP and have recovered or are recovering well at home. 5% needed to be conveyed to a care facility, and this was generally done within 24 hours of the request for conveyance. I would like to assure the House that MOH and the SAF are working hard together, devoting a lot of attention and resources to continue to improve the HRP and its processes. Ms. Sylvia Lim also asked about a related issue concerning the procedures of quarantine and stay-home notices for travelers. There have been some changes to the SHN procedures, which was announced last week, namely to align SHN duration with the quarantine duration. As I've explained at the Multi-Ministry Task Force press conference over the weekend, the healthcare protocols developed over the past months have become complex and confusing to most people. We are undertaking a holistic and comprehensive review to simplify them so that people understand them and can therefore do their part in the fight against COVID-19 and also help others who are in need of assistance and guidance. Let me now move on to vaccination and boosters. Vaccination remains key to our battle against COVID-19. Those who are fully vaccinated with the Pfizer-BioNTech or Moderna vaccine are about 40% protected against infection from the Delta variant. Nevertheless, this is protection against infection of the Delta variant. Nevertheless, both vaccines remain very effective in protecting against severe illnesses from COVID-19 infections. As for the Sinovac vaccine, the number of people who have been administered with the vaccine in Singapore is low, at less than 2% of our population, and we do not yet have meaningful data to gauge its effectiveness, whether against infection or against severe illnesses. But the member who asked this question is probably interested to know about the relative effectiveness of the vaccines. There has been some international data available, including a fairly extensive study done earlier this year. It was pre-Delta, that was done in Chile, which uses a mixture of vaccines. Our neighboring countries, too, have released some data. And all these data show that just like the mRNA vaccines, breakthrough infections are not uncommon amongst individuals vaccinated with the Sinovac vaccine. But the Sinovac vaccine does accord protection against severe illnesses. Those who are not fully vaccinated due to concerns over medical complications or because they experience severe side effects after their first dose of mRNA vaccine, they may take the Sinovac vaccine at public hospitals. As of 3rd November, under this public health program, more than 1,900 individuals have taken the first dose of the Sinovac vaccine, and around 1,300 individuals have completed their full vaccination regime. To Dr. Lim Wee Kiak's question on whether we intend to grant full registration to the Pfizer-BioNTech vaccine, this is something we are looking into once the longer-term follow-up data is fully available to us and HSA has completed its evaluation. To Mr. Dennis Tan's question, we are also waiting for data from Pfizer-BioNTech with a view to extend the use of the vaccine to include children aged 5 to 11 years old. And these are areas we are proactively working on together with the pharmaceutical companies. We have also commenced our booster program. To date, about 550,000 individuals have been invited to take their boosters. 350,000 of them have taken their jabs or booked an appointment. This is before this weekend. I think by now the numbers have gone up. 240,000 of them have completed their jabs. So we are off to an encouraging start. To Ms. Ng Ling Ling's question, the expert committee has recommended and MOH has accepted that individuals eligible for boosters will include those aged 50 and above and all those who are immunocompromised. The expert committee continues to review international data to assess the efficacy and safety of booster shots for younger groups, as well as those exposed to high-risk environments, such as healthcare workers and frontline workers. In time, we will also be inviting eligible individuals who have taken the Sinovac or Sinopharm vaccine to take their mRNA booster shots. However, most of them are not due yet. For policy consistency, Vaccine Injury Financial Assistance Program, or VIFAP, will only apply to the vaccines used under our national vaccination program. Ms. Hertingru asked whether VIFAP applicants would have access to the findings by the panel, as well as avenues for appeal if their applications are rejected. The VIFAP clinical panel assesses applications based on two considerations. First, whether the patient's conditions are related to the COVID-19 vaccination. Second, the severity criteria. The reasons for rejected applications are made known to the applicant, and unsuccessful applicants may apply for a reassessment if there are new supporting medical information. At this stage, individuals' vaccination status, as listed on the Trace Together app, will not change regardless of their booster dose status. We are administering booster in good time, and so this issue of expiring vaccination status has not arisen yet. But in time, this is an issue that we will need to review. Mr. Yip Hong Wing asked about the possibility of exploring a combination of vaccines to be used for the booster jab. The expert committee on COVID-19 vaccination is still studying the heterologous strategy of administering a non-mRNA booster shot that is different from the first two primary series mRNA doses as data emerges. In the meantime, we will administer mRNA vaccines under the booster program as the best available data utilize these vaccines for boosting with good effect. Ms. Jessica Tan asked if our current measures are effective in ensuring that Singapore is prepared for COVID-19 to be treated as endemic. Our transition journey to living with COVID-19 is unique in this world, in the sense that we did not allow ourselves to go through big waves of transmission last year, which many countries did, and suffered tremendous loss of lives. Today, when we see other countries opening up and living lives almost normally, let's not forget the heavy price that they have paid last year. We commence our transition journey only after we have vaccinated the large majority of our population, so that for the vast majority of infected persons, they now have no or mild symptoms. I believe our plan is as comprehensive and as effective it can be given what we know about the virus and the tools we have on hand. But we continue to learn about the virus and improve our responses day by day, week by week. SMS Janil will elaborate on other parts of the plan, but it is still a long battle ahead, which we will prevail as one Singapore. It has been a challenging 20 months for all of us, especially our healthcare workers. Although it was posed as a question, I fully agree and thank Mr. Seah Yao Chen's suggestion to recognize healthcare workers. We have enhanced their salaries, but I think recognition needs to go beyond that. In good time, when the pandemic has settled down or over, we must properly express our gratitude to them and make sure that generations of Singaporeans will be inspired by their bravery and dedication during the COVID-19 pandemic. Thank you.